And welcome back. We continue our conversation with Congressman Mike Gallagher. Congressman, you had a town hall, local town hall meeting recently with hospital officials. What are those officials telling you about their operations during the crisis?
Well, first of all, I just think it's worth everybody in Northeast Wisconsin taking a second, if you can, and whether it's on social media or in person or on the phone, just thanking anyone you know that's working in the healthcare industry right now. Nurses, doctors, also our first responders, our cops, our firefighters. We have a lot of people that are getting a test right now, and they're rising to the challenge. And we're lucky in this neck of the woods. We have such a forward-leaning integrated hospital system, and I do think we're in a better position to weather the worst-case scenario than some other parts of the country. However, what I'm hearing most from both hospital heads, various administrators, and physicians themselves is this concern about testing. I mean, if you look at the countries that have been successful, like South Korea, in avoiding the worst case scenario, and you compare them to countries that have been less successful, like Italy, and if their healthcare systems have been overwhelmed, really one of the common threads is countries that were able to test were able to understand the disease better and the spread better, because testing gives you data. Data gives you intelligence, and intelligence is how you win wars at the end of the day. And so we still don't have the basic supplies we need right now to increase testing at an exponential rate. In particular, we're lacking something called reagent, which allows us to process the test down at the state labs. And so really that is where I think the biggest need is right now. And that would be, but that combined with basic personal protective gear, particularly the masks, both the basic surgical mask and the N95 mask, but also gloves, gowns, things like that. And then obviously there are higher end equipments like ventilators that all hospitals need right now. And so again, sorry to promote this, but if anybody in Northeast Wisconsin is watching and maybe they're in a roofing industry or have a paint company and they happen to have extra masks laying around that you think could be of use to those who are on the front lines, please contact my office. Or email wi08donations@gmail.com. We will arrange a pickup, and we would greatly appreciate any donations to those in our health community that are really fighting this fight on the front lines.
Congressman, coronavirus is at the forefront of everybody's world right now. Are we now in a position where Congress, House, and Senate are putting aside other important issues?
Well, we can't afford to do that. I think it is fair to say that this is consuming most everybody's attention right now. But just for example, in an area that I spend a lot of time on as a member of the Armed Services Committee, our entire Defense Department, all the activities we have in the defense space abroad, you know, we don't get a day off from any of that stuff. Anyone wearing a uniform right now, if anything, their op tempo just went up, because as we muster all the resources we can to take care of our own citizens here domestically, we simultaneously have to send a signal loud and clear around the world that if you are a malicious actor or a nation state that's hostile to America and you're trying to take advantage of us in this time of crisis, we will not stand by and let that happen. And so, you know, we can't afford to take our eye off the ball, whether it's in terms of defense issues, intelligence issues, all the other issues we have to be thinking about. But I do think it's fair to say that coronavirus is and should be our #1 priority. And the quicker we get this under control, the quicker we can go back to focusing on those other issues. Tom, one small thing that I think would help would be to completely deprioritize, if not ignore entirely, anything political right now. I think it's weird, if not downright wrong, to be thinking about a campaign at a time when people are trying to struggle to survive for a few more days or a few more weeks. And so one thing I've decided to do is suspend all political fundraising right now. And also I'm looking to donate at least $200,000 of my campaign funds to local charities. And I would encourage my colleagues to do the same. I think that money would be better spent on helping our citizens in Northeast Wisconsin than thinking about how to run attack ads or do anything political in this season.
Congressman Mike Gallagher is our guest, and we will be back with more with him right after this. Stay with us.